When should a baby, when should a child, when should a young person see the dentist for the first time, and tell me why it's important at whatever that early age would be?
Okay. Ideally, if you can bring your child at a really young age, even 2 months old, well, that's a great age because...
Are you going to change the diapers for me if I bring my child at 2? Okay, sorry.
Really, the importance of that appointment is with the parent. So we don't...
Teaching the parent.
Exactly. We spend a little bit of time with the child. However, it's very important for the parents to learn how to take care of the child's gums at that time because there's no teeth yet. The biggest problem I find is sometimes the parents bring the child in at the age of 7, 8.
Months or years?
Years.
Years.
And then there's a loose tooth, and the first treatment that needs to be done is the needle, the extraction, and then the child is traumatized.
Qua đi, qua. Giỏi, bravo, giỏi với ta đi. Kìa đi, bye bye nuôi, bye. Giỏi.
Old MacDonald had a farm, E-I-E-I-O. And on this farm he had some ducks, E-I-E-I-O. With a quack quack here and a quack quack there, here a quack, there a quack, everywhere a quack quack. Old MacDonald had a farm, E-I-E-I-O.
Or we see parents coming in and then all the teeth are rotten, and the reason is because they didn't know that you're not supposed to give your child milk in a bottle at night, because now there's a lot of sugar in milk and it stays there for 8 hours straight.
Right.
And when you sleep, there's no saliva, so there's nothing to buffer the acid or to fight the bacteria. So then what's the first treatment? Either filling or sedation. Sucking your thumb is a big problem because what happens is your thumb has a certain shape and it's quite narrow. And your child, as they grow, the bone is so soft that if you suck your thumb, you can mold the bone, and your palate will be the shape of your thumb. If your children's teeth are crooked, they may have other issues, and normally we like to see gaps between teeth for kids because the adult teeth...
The baby teeth?
Yes.
Gaps?
Yes, because the adult teeth are twice as big. So if there's no gaps between the baby teeth, it looks fantastic when they're young, but then they're more prone to...
The jaw is still growing though, right?
Exactly.
It's like, okay.
But if you're lucky, it's going to grow enough for the adult teeth, but most of the time, if there's not enough space, chances are your child will need braces. I have a young family. I have 2 kids. My son is 5, my daughter is 3. I'm a family guy. We do everything for our kids. And when I noticed that they both have dental problems and it was genetic, they have what we call a cross bite, where the lower teeth are actually covering the upper teeth. So yes, they're cute when they're kids, but once they hit 17 and they're not biting properly, it's a huge problem. And the reason why I really got trained in early prevention and early treatment is really because I wanted to be an expert for my kids